the webinar. We're going to get right into things. So you'll see this first screen, and there might be a tad delay in what you see and what I see, so just bear with the somewhat of a delay through the program. This is a cartoon that I like. They tried adding healthy snacks to the office vending machine, but all that rotting fruit made the candy bars taste bad. You know, when it comes down to the whole notion of if you build it, they will come, it doesn't always go that way. You know, sometimes you have the best intentions with what we put into the workplace pertaining to the health and wellness of your employees, but some of the time they just don't engage. And it can also be a little bit, you know, not so nice if you put a lot of effort into putting some things in the workplace. So we're going to talk about some strategies today to maybe help with that particular piece of engagement through any wellness programs that you might have currently going on. There is a bit of feedback going on. I'm not sure if someone has unmuted themselves or if that's possible, Garth. I don't know if you could check. There's a bit of, I can hear a bit of noise in the background there. That's much better. Thank you. So the next slide here we'll get into is three really poignant questions when it comes down to your workplace, and what your culture looks like. So, you know, the first question, what does having healthy culture really mean to you? That's an important question. Secondly, what have you tried over the last couple of years that you know, pertaining to wellness or any wellness initiatives? And lastly, did you see any changes with those particular things that you would have tried? Were they measured? What were some objectives? Were they hit? Were they met? So these are three questions we're sort of going to play around with today to help really make an impact with when you build it, they will come, pertaining to various strategies that might help. So when it comes down to building a well culture, there are a few things that I'm sure any of you on the call today would obviously understand if you have tried to put in wellness at your workplace. Some of these particular questions and comments, you know, you might not have, you know, when it comes to your checklist of putting something in. So building a well culture, it really does start from the top down. And looking at the senior management support and are they supportive of what you're wanting to do? That's a really big one. Yesterday we had lots of conversation about that particular piece, which I'm sure we could get into a little bit later as well. Secondly, do you have a cohesive, inclusive wellness committee that is simply a cross-section of your entire organization? That's a really important piece. I'm going to get into that a little bit later, but that's another real key when it comes to the whole visibility value involving your frontline staff to be involved. Those are really some great things to think about is having an established wellness committee if you don't already have one. Even if you don't have a wellness program, it's a really great option. Third is, what data are you collecting to really put, you know, for the powers that be, so to speak, the upper management, you know, they want to see, is this really going to make a difference? And so really setting the business case is a really great option in really looking at what data you can collect from your HR department, from, you know, your benefits provider, broker, whoever you can work with, to really get an idea of what your health costs really look like. From there, then you want to look at choosing the appropriate interventions to address risk factors. So, you know, it's not necessarily just throwing a healthy vending machine in a work site and hoping that people change their habits, or, you know, putting a bike rack out and hoping people ride their bikes to work. It really does come down to what are the main health risk factors and what strategies and interventions, so to speak, can really be impactful to make a difference year to year. Creating a supportive environment, that certainly stems from top down. Planning short and long-term goals, objectives. I'm going to touch a little bit, it's another full webinar in itself, but how wellness fits into the strategic plan. That's another big piece, is if you can try to figure out a way, if wellness is important to you in your workplace, is figuring out a way to have wellness literally on pen and paper embedded in the strategic plan corporately. It really does have a little bit of more of a voice than just something nice to do for your staff. So if it can be strategically placed, it's another great way of getting it in there. And then finally, assessment and measuring some outcomes. What are some of the areas that you can measure? And we'll talk about some strategies that you can certainly take back to your own workplace as we go through. So this next slide, you'll see it in a matter of a couple of seconds here. There you go. Is a common slide that we like to talk about just to give you an idea as to where your costs lie. This is a particular graph that we like to show, literally going from far left, healthy or low risk people, all the way up to active disease. And you'll see the first 3 bars. And then the last 2 bars. The last 2 bars, early symptoms and active disease. When it comes down to your costs, really 20% of your employees fit within these 2 areas of illness, which cost you the most money. 20% of your people generate 80% of your costs. I mean, that's the typical thing across the board where we see unhealthy people, unfortunately, just cost more money. So that is something that, when we look at the preventative approach, is if we can keep the healthy, so 80% of your employees generate only 20% of your costs, that's an idea of the prevention model, which really we're going to dig into a little bit here to see how, if you were to put in a wellness initiative, how you can really look at embedding that particular strategy within your organization and have it really be impactful. So looking at the healthy, making sure that we cater to them, as well as obviously an objective is pulling some of those high-risk individuals over to our side, so to speak. So pulling them down on the lower risk profile. So we'll talk about some ways that can happen. This is an interesting slide too. It's called the readiness to change, and then we're going to get into some nuts and bolts here on some things that you can take back to your own work sites to really make an impactful change when it comes to any initiatives that you're currently running. But this is a common levels of change that everybody is in. So it goes from pre-contemplation, contemplation, preparation, action, and maintenance. And if I could just focus on the bottom 2 for a moment, action and maintenance. This is where most organizations spend their most time and money. Gym memberships on paper sound like a really great thing to offer to staff. Unfortunately, those people who are in the action maintenance stages are only the small part of the population that will actually use it. People are well intended, but people are people, and there's so many different barriers and obstacles that people have to get through before even setting foot inside to a gym. So it's again something that we like to share. That really the most opportunity for positive impact and change really does come from the people who really don't know what they don't know. The pre-contemplators that might have just come from a doctor's appointment or have never had a doctor's appointment, a physical, and they're diagnosed with borderline diabetes. They're still in denial. They really don't know what that means. They might start to think about making some changes as they get down to the contemplation stage. And we see often when employees engage in wellness that they are already shifting themselves within one of these areas. And then the idea, as you can see the flow chart, is to get them down as close to action maintenance as we can. And that's sort of where we wanted to really focus today, and how do we make that happen? It really does get down to a lot of different things. We'll touch on a few of them today. So the next part here is looking at communication, 3 areas that I want to spend a bit of time on: communication, engagement and outreach, and assessment. And this is really, the next 3 slides, I guess, is where when Garth said get your pens ready, it's probably the most important part here, is to look at what you're currently doing and how you might be able to make it a bit better. So the first one here, if I could just get there we go, is strategies for optimal communication. When it comes down to messaging and communicating to your staff, some organizations really do a good job of it. Some organizations don't, and so everyone's on a continuum somewhere. If we can figure out better ways to spread the message, and wellness, I'll use wellness as an example today because it's the theme of the day, is what do you have access to that can really make a difference to get that messaging out there? Keeping in mind you have pre-contemplators, contemplators, and people who are already active and healthy and will not cost you much of a dime. So when it comes down to spreading the word, there certainly needs to be things taken into consideration. I'm going to start with the physical piece. If you were to think about any space within your organization that you can use, I have some examples here, some physical spaces to put signage and information. Wellness bulletin boards would be one. Media boards, so some organizations have the big TV screens. Bathroom stalls, and some of you might be chuckling and thinking, bathroom stalls, I don't know if that would go over very well. You'd be quite surprised. You know, something on the back of a bathroom stall actually goes a long way. I wouldn't necessarily put a recipe back there, and I'm speaking from experience. They do tend to go missing, but some information on what's going on, what's planned, you know, what's the update for wellness. Those are sort of some of the things that can happen there. Any opportunities on pay stub drops? I mean, I know some organizations really look at electronic ways of paying employees these days, but again, some organizations still have pay stubs and they can use that. I know one of our organizations also has monthly memos that their supervisors share with all of their department on a monthly basis, and wellness is part of that. So poster staff meetings is another one, is really tying in wellness at any level you possibly can. I'll get into that in the next slide when I talk a bit more about culture. Intranet. You know, intranets are kind of funny. Either the staff are all over it and they understand where to go, and it's been clearly communicated how to find their way around the intranet, or it's not. And sometimes people are completely miss it when it comes to, you know, it's a great initiative, but people just aren't going there. And a lot of it is a lack of communication and showing maybe staff how to go about it. Having a wellness tab is not a bad idea if you do have intranet, because that's where you can post various recipes, what's going on, when your pedometer challenge is starting, maybe some high-level updates, as well as if you have a corporate newsletter that goes out on a quarterly basis, typically, or semi-annual, whenever they go out, you can have someone from your wellness committee submit a recipe or an update or something, call it the Wellness Corner, and all of these little drips and drops of wellness messaging will hit your people in different ways. So it's the common denominator here is a lot of messaging in different modalities to really touch the most, the highest percentage of people you can. And then email and communiques from senior management to show support. This goes a very long way. If you have a health fair at your work site and you're allowing staff to participate for an extra half an hour, you know, a message from your VP or president or owner or whatever, and just letting staff know that, you know what, we're allowing you to participate in this, enjoy. It really goes a long way, that communication. And it doesn't have to be for any specific event. It could be for anything. If you've been recognized for an award, or if you've been, you know, planning a new initiative that you really want buy-in from all of your managers, this is again something to think about. As someone pointed out yesterday, though, senior management isn't always the easiest to get. So that's something, a bit of a communication we can have probably after. Excuse me. The second area that I wanted to focus on is engagement and outreach. And I guess when it comes down to engagement and outreach, they do go hand in hand. You know, there's one thing about putting in something and hoping people come, which is all well-intentioned, but unfortunately doesn't always happen, even gym memberships. So really looking at ways and clever ways to go get them. So we call those outreach strategies. Which levels of your organization can you really impact? And different areas may mean, as I said, staff meetings, health and safety meetings, any board meetings, any opportunity to put a wellness update, whether you have a wellness program or not, but anything wellness related can certainly help with your overall engagement. And again, at all levels of that particular area. I know one of our organizations, we work with a utilities company, and unfortunately they can't participate at noon hour lunch and learns or noon hour wellness sessions or exercise classes because they're outside working on the telephone poles. So, you know, we really had to think about ways to engage those staff. We've been part of their health and safety meetings. So on a quarterly periodic basis. So thinking about ways you can really touch those particular groups is a really, really good option. Peer influence is another one. I know, when it comes down to physical change, healthy living changes, quitting smoking, things that people are proud of doing within their colleague and frontline peer group, they're really, really most of the time motivated to talk about it. We call this the peer influence effect. So if you do have a pedometer challenge organized for this spring and you have a real go-getter that's on your wellness committee or not, but you're really liking their enthusiasm and attitude, they can really influence their peers in participating in various ways. So really picking out those types of people can also be beneficial in the long run. The third piece there is family trickle effect. We call that, that's an important piece as well to any initiative. Not necessarily all, because obviously your focus is on your people and your people staying well and healthy and whatnot. So if you can think about ways to involve the family though in various areas, getting them exercising, getting them moving can also really help with the overall trickle effect. And then inclusivity. Don't wait, go to them. We talked about that earlier when it comes to every single department being included. I know some organizations have large groups, large offices, large administration buildings, and then some smaller satellite offices, and maybe even some smaller departments. IT departments typically aren't that big, 3, 4, maybe 5 people. They can't be forgotten though. So if you do have a program happening, you want to make sure that the same message gets to that small pod of people. So really keeping that in mind can also go a long way. Under consistent messaging there, we have, again, just some food for thought, I guess, for lack of a better word, and no pun intended, that some organizations have an opportunity to have a cafeteria on site where you might have a third-party vendor, being the people responsible for the meals. One of the strategies you can do is really working with that third-party vendor is looking at their menus for that particular day, and we call them Wellness Wednesdays. It's an easy sort of thing to think about, and highlighting various menus that the particular vendor might have. It drives people to the cafeteria. People know what they're eating, and highlighting some of the ingredients and what they're using and what they're doing. So it really does come down full circle. If you don't have a cafeteria, a great option, say in January, might be in your lunchrooms or in your photocopier rooms or any high traffic areas. Put a few, cut the junk baskets out, just fresh fruit and some nuts. You can buy them Costco or grocery store, wherever. But that messaging goes a long way. We like to call that cut the junk in January. Great option for you. You might want to jot that down to put out in January or in other times during the year. If you need to subsidize it, a quarter or 50 cents or what have you, then you can certainly do that. Putting some ideas around on stretch ideas while they're photocopying or while they're faxing or whatever they're doing in the copier room. So these different, we call them essentially drips of wellness messaging in different ways. And these are different things that you can think about to really integrate into your overall idea of a program. And then finally, under this particular piece, at policies and procedures, some organizations take an even more strategic stance where they declare their office or their organization smoke-free. Some organizations work toward that. Others really take the stance of, if we're going to change our culture, we're going to start from at every level. And we're going to ensure that every staff meeting that we bring food in, it's not going to be just Tim Hortons, muffins and coffee. We're also going to have a bowl of fruit. So that messaging really goes a long way. At least it's an option. We not necessarily can get rid of everything, overnight, but to gradually see those opportunities to have your staff involved in making the proper decisions and ensuring that your environment supports that can really go a long way when it comes to the overall behavioral change of your people. Finally, is the strategies for assessment. Is what you're doing working? And it's a great question to ask, is if you did a pedometer challenge. I remember doing this presentation a while ago at an HR group, and the lady said, yeah, we had a pedometer challenge last year and it was awesome. This year, nobody's doing it. So it's just sort of an idea of what worked, what didn't last time, and can you duplicate the same success year 2 or year 3, what have you. So it's an important idea to really get a handle on assessment, evaluating, and reporting, and the powers that be, your senior management team, board members, whoever are making the decisions on wellness, and because it certainly does take some resources, that's important to them. So really getting a feel for what is costing the most money in your organization, if you can get that information and start to look at how you can track some of that information, will go a long way. Also, with your wellness committee, we've recently rebranded all of our wellness committees to be wellness champions, where we have check-ins, we have forum, we bring all the feedback to the particular meeting and we talk about it. Feedback and testimonials, gathering those, asking people to submit 1 or 2 sentences to a key person on your committee really can be embedded in your reports if you have to include those particular pieces of information to the powers that be. Success stories, positive roundtable is another great nugget to grab from today's talk. I can't tell you how powerful this is if wellness can be part of your health and safety agenda or staff meeting agenda or any possible way, you can even figure it out beforehand, is what are some positive things that have happened since your last meeting? Only positive. No negative, only positive. What are people seeing? Are they seeing people grabbing more fruit from the cut the junk basket? Are people stretching more during their day? Is there encouragement to get out and start getting some walking groups going around? So what are the positive things that you see as a group, and share those verbally and openly. It's very helpful. Wellness suggestion boxes are also a great way to gather feedback from your staff. They can be done virtually. They can even be done physically. Some organizations get a big red toolbox and put some ballots beside it and have somebody check that periodically. I talked about the wellness strategic plan a little bit. I'm going to bypass that right now. That's another idea, again, to think about is if you do have a corporate strategic plan, get wellness in there somehow. The easy tie-in is looking after the people, and that's a great way to plug it in. And then lastly for this is, why not get recognized for what you do in your work site? So there are so many regional and national award opportunities that your company may be able to be nominated for. You can work very closely with your benefits provider and any other organization that you might want to work with to see if this might be fine for you. I can tell you that not only is it great for senior management, board members, etc., to be recognized this way, but also talk about value and visibility for your staff. If you can win a regional award on a healthy workplace, it really goes a long way. So it's something to think about at least. Stick and stay, these are just some examples of if you do have to provide reports to ensure that what you're doing internally makes sense. These are just some examples that you can think about. Progress report can be done semi-annually. HRA typically can be done annually, doesn't always have to be done annually, but it can be, to really keep an eye on what are the health risks and what they're presenting, and then really fitting them with some methods to your madness pertaining to intervention. Wellness committee minutes, making sure that those are available to staff as well as they are kept up to date. And of course, hearing from your staff for various interests. What do they like? What do they want to see? And having those happen periodically is also a benefit. So when it comes down to looking at the comprehensive approach to wellness, and this is a very comprehensive approach, and you may see and use some of these within your organization. Some of you may not have the resources to do so, but certainly will give you some ideas. If you have the opportunity to work with a third-party organization, we can, certainly some can provide really great health coaching one-on-one to help get to the behavioral change for the individual, which is invaluable when it comes to tracking some of the costs and risks. Group and awareness is where most of you are probably implementing various programs now. Wellness challenges, lunch and learns, health fairs, posters, that sort of thing, which are good, but they all have to link together some way, and I'll get into that next slide. And then finally, those who like the visual, sort of the virtual piece, the apps, the cool different tracking systems on their phones. I mean, this is the new age now. Then it's certainly something to think about if you're doing some sort of initiative to include all those different levels of learning and want and interest from your staff base. So this is a very comprehensive approach to wellness, but it can kind of give you an idea as to how it'll all loop together. which in my next slide will give you that example. So what I did for this particular slide is I showed you, I took weight management as an example. This is a 12-month look at how weight management is the common denominator, the common theme throughout every single thing that you choose to do within your organization. So, I'll just go over this quickly. You see all the red piece, the highlighted red is kind of what I'm going on. Cut the junk in January, some ideas in February, health fair in in the spring, early spring, pertaining to healthy weights. You could bring the Diabetes Association with you to talk about how that has impacted smoke, Heart Stroke Foundation, that sort of thing. Walking challenge, how that impacts weight management. It's in you to move. It's another exercise type lunch and learn. If you've got a company golf tournament going on, ensuring there's water and healthy snacks available. July and August are typically lower on the engagement scale because of holiday season. So recipes, having your people really involved with and ensuring that they're getting that information. And you can kind of see the examples there on how the integrative approach can be beneficial when it comes to making sure the message is there. And again, it doesn't have to be 12 months, it can be shorter, but this gives you an example of how that particular theme is there. Certainly take some ideas from that. So my last 3 slides are going to give you a bit of results. So these are particular clients of ours that we have looked at this comprehensive model with. We have essentially taken the integrative strategic approach to looking at their health risks, what are the main focus for the first year and onward, and then some of the results. So this is a utilities company. Our initial year, we wanted to look at those sort of ideas on healthy eating strategies, weights, lifestyle habits, and exercise. The top HRA risks were cancer risk, weight management, and nutrition. And some of the trend results from this particular organization over the last 6 or so years have been a 5-day reduction in sick time, which was certainly a great thing. We did also see some reductions in drug costs and health claims over the same period, and every year we did our HRA, we did see a reduction in every health risk. The engagement at all of these companies is very high, which is certainly correlated to some of the results that you're going to see. Not-for-profit organization, this is one that has 17 different offices, 1 big admin office, and 16 daycares in a number of communities. So we really wanted to focus our first year on culture, inclusivity of every single site. How can we ensure that every single daycare, small or large, their staff were involved? And that's something that we've really been focusing on, and we're still focusing on, certainly. Some of the main health risks: nutrition, weight, fitness, heart health, those were certainly some of the things we looked at. And over the last 3 to 4 years, overall health costs combined, drug claims and extended, we did see a reduction. Nutrition health risks and heart health, coronary heart health risk as well, we also saw some reductions. We did a big campaign on cholesterol and blood pressure, and that certainly made a difference for us when we were starting to track some of that information. Then finally, our financial organization, one of our financial organizations we work with, this particular group, we wanted to really focus on culture. They merged with another organization and wanted to really start off with a fun team challenge to ensure that we had some people, from all of the different the 2 different organizations participate. So we also looked at weight management, cancer, and fitness for the main health risks initially. Then these were some of the results over the last 4 to 5 years, 5 to 6 years now. We did see as well some reductions on some of the main costs. So it's apparent that you can certainly have a return on investment if the messaging is where it needs to be, if the communication is where it needs to be, if we are including every single possible department, satellite office, employee, every single physical way to get messaging to them, involved in every agenda you can. It does sound redundant to some of you, but I promise you that with those particular strategies, with whatever you implement, you will find you'll have better engagement, better reception with your staff. Really, we've shown healthy employees really do cost you less money, and that's certainly the bottom line, is how can you make as fiscally healthy as you possibly can. And these are just some ways you can do that. So, Garth, I'm going to open it up now for questions, and I think if you wouldn't mind fielding them, and then we can answer them, please.
Not a problem, thank you. I do have a couple here. The first one I'm just going to throw out there. As far as support goes, that's one of the challenges the one person on the webinar has been having as far as support from upper management. Is there any tips on that, or what we have found?
Yeah, so when it comes to senior management support, I mean, we could have a full hour conversation on how to engage those people, and sometimes it's not easy. I mean, we've even been up against that. Is how do we get these senior managers around to the whole idea of wellness? You know, having open conversations with them to find out what their hesitancies really are. What do they don't know yet? Why aren't they saying yes to the resources or yes to some of the opportunities that you might be presenting to them? Is what's really in their way? Is it too much money? Is it we don't need it? Our staff are fine. What are the different levels that you can really understand? And the more you understand, the more you can bring them, I guess, the case in building a business case for your upper management team to say, look, this is really something that I think industry is saying. Socially, we need to make sure that we're responsible, and this is a great way of doing it. So it may take time, certainly. It might not happen overnight, but dripping on them and starting something internally, you know, with just your own organization, your own staff members, can go a long way, just to show them that, you know, this is something we can do, but it might not be enough. So this is something else we want to try, and sort of try and find some opportunity to work with anybody on the senior management team that might have an interest in the responsibility you want to have for your staff.
Good, thank you. The second one here that I have is around stress. So those who are struggling with stress, how do we get them into the wellness program?
That's a really good question too, and that could be another topic. I know that Garth will introduce sort of the next webinar that we're going to be doing in July, and we might be changing focus a little bit for this particular reason. Stress is we had this question yesterday. Stress is a really tough thing for some people to even talk about, to even admit that they're struggling. And if there are some concrete concerns or issues within your workforce, so job insecurity, bullying, other areas of stress that people are under, is it just workload? I mean, are there different things that you can do internally to help alleviate some of that stress? That's a great question to ask. Now, what you can do about it is, after you do a bit of an assessment to see kind of what's going on, you then might be able to do something as bring a certified speaker in to talk about the topic, or different strategies around stress on quality sleep, or what foods to eat to lower stress levels. And these are, again, might sound superficial. I don't mean them to sound so. The other area that you might find, if you start to kind of understand what stresses are going on, it's not easy to find without being certified and being a professional, and is mental health in the workplace. And this is something that is becoming more and more and more evident, and the mental health piece and how that is stressful for people. So that's another big area where the right people, the right company can really help with that particular piece, with assessment and resources, and really getting to the bottom of what's really stressing your people out.
Good, thanks. Yeah, and for everyone on the call still, I just forwarded via chat, the chat box there, our website. Yeah, it is a good point, Megan, just to bring up that has been one of our focuses over the past 6 months to a year, is where and how can we help with the mental health area. So it is probably going to be a change we're going to make in the next webinar that we'll have coming up in July or August. So keep an eye for that. We'll make sure that we email everyone on that topic. But as far as our position and where we're going with mental health, it is going to be a more comprehensive program. It's not going to be solely resources to give your employees access to. And I just forwarded on the link to our webpage, so that if you're interested in seeing more about that, you can hear there as well, or have a look there as well. So I'm just going to take one last look through here. Didn't have any more questions that were popping up. So Unless any do come back in, we're going to end the webinar here. And keep an eye for the next webinar that will come through. Please feel free to forward it on to colleagues, to current staff members, to management. Get them in on these calls to, again, reinforce that message of wellness within the workplace to them. But I do thank everyone for taking the time out of your busy day to listen to this. And if there are any specific questions about workplace wellness that you have for us and our staff, please do forward that on. You can just simply email info@EWSNetwork.com, and or Megan or myself with just our names at the front of it. Megan's information is on the final slide here. So if that's all, I'm going to say goodbye for today. And everyone, thanks very much for attending, and we will talk to you soon.